Well, about 90,000 expired Pfizer vaccines are going to be destroyed at the end of March. According to the Health Department, the current stock of millions of Pfizer vaccine doses will expire in May, June and July. Let's get more on this. We're joined by Mia Malan, founding editor-in-chief of the Bhekisisa Centre for Health Journalism. Mia, thank you for availing yourself this afternoon. We've seen a number of countries, especially on the continent, having to get rid of expired doses of vaccines. Malawi and Nigeria burnt theirs. We understand Liberia, Mauritania and the Gambia are also among countries that had the burden of having to get rid of expired doses. Is there a standard in terms of how they're disposed of?
I don't know enough about the technicalities of how they get disposed of, but what I do know is that it's a complex and an expensive process. And that is why in South Africa, our health department for over the past month has not been using this batch of March vaccines that will be expiring, but rather distributed vaccines that will expire at a later date, because if they had to distribute the current vaccines that are expiring today and they weren't used at sites, they would have had to be destroyed there or been transported back to central sites. So all the 900,000 vaccines that will expire today are in Johannesburg at central sites where they will get destroyed. But it's not a simple process and it's not a cheap process.
And that's just it. To your point of it not being a cheap exercise, it is reported that those on the brink of expiring are worth at least 13 million rand.
Yes, so it is of course very unfortunate that they are expiring, and it's largely due to uptake not being as expected. But the 900,000 that will expire today is only about 0.25% of the vaccines that we've received so far. And the World Health Organization does have an acceptable rate of vaccine wastage, which is about 10%. But of course, as you've mentioned, there are many more vaccines that will expire, about 11.5 million in May, June and July. And we now need to try and increase uptake. I'm not sure if we're going to succeed to do that. One of the things that the health department is trying to do is to donate some of these vaccines or swap them via COVAX with countries that need vaccines now but they don't have them, and then to give us vaccines back when they with later expiry dates at a later stage. The issue with it is that it's Pfizer vaccines, not J&J. And the issue with Pfizer is that it is much harder to store it and they expire quicker than J&J vaccines. So the countries that COVAX help are mostly poorer countries that don't always have the facilities, the special freezers to store the Pfizer vaccines. So it's hard to find countries that can take the vaccines and then distribute them and store them correctly. And as you may know, there are also wealthier countries who are donating vaccines, very often Pfizer vaccines, and they don't ask for exchanges, they just donate. So when a country has to decide whose vaccines are they going to accept, they may be more open to a country that don't ask to exchange, but just to donate. So it's a complex process. The health department has offered 5 million of the doses that will expire to COVAX, but they don't have a deal yet.
Mia, I may have missed it, right? So I'm on the SA coronavirus dashboard. And when we speak of transparency, just how transparent has this part of the process been in terms of South Africans knowing just exactly how much vaccines we've received, where we're sitting at, and when the expiry dates will be?
So the coronavirus dashboard doesn't give you that information. It just tells you how many vaccines, how many doses were used each day, and then it gives you also information as to what percentage of which age group has been vaccinated and how many people, for instance, have received boosters. The information about expiry dates and how many vaccines have been used so far and how many have been distributed from central warehouses to provinces, that's not information that is released on a daily basis. It's information that you would have to request from the health department. I've done that before and did get the information, but it's not information that you get if you don't ask for it. So I won't say it's not transparent, but it's definitely not information that you can access, without asking for it.
Fair enough. We spoke to a commentator on the program, I think last week it was, and she mentioned that she went to a number of vaccination sites. She didn't find any, and she spent the entire day, driving around her neighborhood and surrounds to see whether they're open. And she suggested that, you know, the slow uptake as well might further be exacerbated by the fact that some vaccination sites are closed. Is this something that you are aware of? If so, your thought on it?
Yes, so I think the issue with closed vaccination sites mostly relate to private sites. And the reason private sites close is because they have to buy the vaccine. So if the vaccines aren't used and they don't have a high enough uptake, they lose the money. It's different with government sites. They receive vaccines, but they don't physically, lose part of their income if the vaccines aren't used. So I think it's mostly some of the private sites that have closed. Mostly if you go to a government site and you, for instance, want a booster and you want to mix and match, so if you want a different brand from what you got vaccinated with, most of the government sites have both brands, and they mostly open from 8 to 4 o'clock. Here in Johannesburg, I have looked at quite a few that are all still open. But what you do have a challenge at is because they working quite carefully with the vaccines, that at many of these sites, if you, for instance, go later in the day, say if you go past 2 o'clock, you may not get the vaccine that you want because, for instance, in the case of Pfizer, because they have to be stored in special facilities, they often count the number of people that want a Pfizer vaccine at that stage and then only keep that number there, plus maybe 1 or 2 extra, and the rest of it they send back and then they return the next day. So best way to get a vaccine at the moment is to go early in the day so that you make sure there's still enough stock. But yes, some vaccines have closed down, and I think it is difficult for people to not know which vaccine sites have closed down. And certainly if you're a bit vaccine hesitant and you have to drive around to find a site that has a vaccine, surely that's going to impact on whether you then get vaccinated at the end of the day or not. But I have found that most people that go to government sites here in Johannesburg, where I live, have been able to get help, but with private sites there have been challenges.
So since February last year, the country received more than 39 million Pfizer vaccine doses. I wonder then, with so many about to expire, and we talk about June, July as well, given the rate of hesitancy where vaccination is concerned, what then happens in the country? I appreciate you're not with the Department of Health, but would it be a good idea to procure again?
So we are not going to procure again. The Health Department has actually publicly said that once we use the last batch of Pfizer vaccines, which expire at the end of July, they do not have a budget to procure more vaccines. So if you want a Pfizer vaccine at this stage, you would need to get it before July 31st. After that, you'll be able to get vaccinated, but you'll have to use a J&J vaccine because we will still have those doses left. And you may ask, so why is the issue with Pfizer and not J&J? And it's because Pfizer vaccines have a much shorter expiry date than J&J vaccines. So if you store it at minus 70 degrees Celsius Pfizer vaccines, they last for 9 months. And by the time that they arrive in our country, often it takes a while to get them here and to go through all the administration. So often when they get here, they only have 8 months of shelf life left. Where if you store J&J vaccines at minus 20, which is a normal freezer temperature, they last for 2 years. So we will be much more able to have J&J vaccines that's available after July than Pfizer vaccines, because at this stage there's not another budget to procure more of those Pfizer vaccines.
Mia Malan, founding editor-in-chief of the Bhekisisa Centre for Health Journalism, thank you very much for availing yourself this afternoon.